So there was certainly a rush to implement this. Intuitively, I think everyone has known telehealth should play a key part in patient care. With the technology advances we've had, it just makes sense that certain visits would be virtual visits. But due to a lot of obstacles from regulatory, payer obstacles, there really wasn't widespread adoption prior to this situation. So during this rush, there was some real challenges. I would say the first obstacle that practices faced is the fact that the telehealth providers themselves, many cloud based tools, in a span of 2 weeks, had hundreds of thousands, millions of new users being added to their platform. So the first thing was there were a lot of workflow speed issues with the products as people all used them. And this wasn't happening just in healthcare and oncology practices. That same 2 week period, there were millions of students using some of the very same platforms we're using for telehealth. The next thing that really became a challenge was workflow. Oncology practices have very specified workflows for appointment types. So this is what happens for a new patient. This is what happens for a follow-up or a chemo symptom visit, and this really threw them into disarray, trying to understand which appointments and which patients, based on their conditions, could effectively be seen with telehealth visits. And so, a lot of the practices we serve, what we saw was a very, very rapid iteration of understanding what types of patients and visits could be seen and how quickly could they pivot to those new protocols. I would say another challenge was technology. While most of the COA practices that we work with and are familiar with have really robust technology within their organizations, those systems were never designed for telehealth, in the sense that you would have providers on maybe wireless networks that weren't really designed for nonstop streaming of video and audio, and they would experience performance issues. So there was a lot of, I think, tuning that had to happen both on the physician computers, the wireless networks, and also the physician's home networks to make sure that there was a consistent experience for the patients.